the gentlewoman from Ohio's 3rd District, Representative Joyce Beatty.
Mr. Speaker, let me first say thank you to my colleague from Virginia, Congresswoman Jennifer McClellan, for yielding to me and for leading this special order hour. And I want to also thank our chairwoman, Congresswoman Yvette Clarke from Brooklyn, New York. You heard her as she came to the floor, Mr. Speaker, sharing with us the value, the importance of why we are here tonight. And as you have also heard, not just tonight, but for weeks we have come to this floor. And Mr. Speaker, the question you should ask yourself is, why are we here? Why are we standing here and telling these stories? Stories that I am sure people in your district and your colleagues have heard also. Well, we come tonight because we want America to know how important our work is. But more importantly, we want America to know that Democrats are standing up for them. We are united in this single cause because it is our top priority. And tonight, we share the stories of our constituents. We do it as a reminder that others turn away from the struggle. But the Congressional Black Caucus leans in, standing in the gap for families who can't afford for Congress to look the other direction. Mr. Speaker, I rise to share the human cost of allowing the Affordable Care Act health care tax credits to expire. I rise on behalf of the families of the 3rd Congressional District that I serve in the great state of Ohio. I rise on behalf of the families across this nation. I rise on behalf of the 18+ million Black Americans that the members of the Congressional Black Caucus serve. And yes, Mr. Speaker, I rise on behalf of the 82 million Americans that the Congressional Black Caucus serves. Families, Mr. Speaker, who sit at the kitchen table late at night, wondering which bill they can pay and which bill must wait. If Congress fails to act, 35,000 people in my district will see their health care costs rise. Let me just give you an example. For a 60-year-old couple earning $85,600, annual premiums will rise by almost 300%. Unthinkable. And 15,000 people in my district will lose their health care altogether because Republicans' refusal to extend the tax credits. And 48% of the ACA marketplace consumers are small businesses. And I have heard colleagues on both sides of the aisle talk about it is the small business owners who are the economic engines of making this America work, the backbone of communities, communities like my community in the 3rd Congressional District. If I would go back and remind you, Mr. Speaker, and all those who are listening, it was the Democrats with our American Rescue Plan that expanded the promise of Affordable Care Act to make health care more affordable. I could take you back to 1965, Mr. Speaker, when then, too, we were dealing with health care. And it was the government body that came up with Medicaid and Medicare to make sure that we protected the American people and provided not just for the wealthy, but for all, for the least of us. And tonight, I want to put a face on it, Mr. Speaker. I want to lift up 2 Ohioans who put names to these numbers. You see, it is not about the politics, as our chairwoman said. It's about people. It's about everyday people. So let me tell you the story of Tracie, a small business owner, who wrote that her family's premiums have tripled. Before the tax credit, they were paying over $1,000 a month just to stay insured. With 2 children in college, she wrote, "Our family relies on these subsidies just to support our students and pay our bills. We don't live extravagantly. Please, Congresswoman, keep fighting for us." Let me tell you the story of Mark, a 60-year-old husband and a part-time worker. He told me his ACA premiums will rise $11,000 in 2026. He may have to return to full-time work out of fear that he and his wife will be left without health care. Mr. Speaker, I could tell you story after story and put a face on it. I could tell you the stories that my colleagues from across this wonderful America that we live in, we all have stories. You see, healthcare is not about Democrats and Republicans, it's about people. So tonight we come to this chamber, to this floor, the house of the people. We come here tonight to share with you the stories because we are coming, because we want hope. We want to provide hope to the American people. We want to be able to tell them that they don't stand alone. We want to be able to tell them that we really believe that we can make a difference, that we can provide affordable, quality health care for everyday people. So, Mr. Speaker, Democrats stood united, as you know, for more than 40 days during the Republican-caused shutdown to prevent this. But here we are. Here we are. But Republicans refuse to negotiate. Health care, Mr. Speaker, is a lifeline for families who have upheld their end of the bargain even when Republican policies have not upheld theirs. Mr. Speaker, my ask is very simple, and here it is. Congress must act. Congress must restore these tax credits and protect affordable health care. Mr. Speaker, I guess the question really is, what do we say to that family? What is the answer that we say that we cannot negotiate? What is the answer that we say to them that we cannot bring it to this floor? What is it that you would like me to say to the American people? What is it, my colleagues on the other side, that don't stand united with us for the people? And I guess that is why week after week after week, we not only come to this floor for special order hours. Mr. Speaker, I want you to know how important this is, that we go out into our districts. And because we know people are making a decision between health care, feeding their families, putting a roof over their head, I could tell you the stories of my colleagues. I could tell you the stories of colleagues who have gone into hospitals and healthcare clinics and volunteered services. I can tell you that I have bagged and boxed food for people. I have contributed, like many of my colleagues, to make sure that when people have to pay for their health care and they're trying to decide if they could buy groceries, that we are coming to their rescue. So tonight I end with asking you, not to come to our rescue as Democrats, but come to the rescue of the American people and let us make a difference by negotiating and having an American health care plan that will make sure that all individuals can have affordable health care. Thank you, Mr. Speaker. Thank you to my colleague for this special order hour. Thank you for your brilliance and your tenacity that you come here and stand and tell the stories and lead us so hopefully we will be able to make a difference. Thank you, and I yield back.